everyone, this is Kelly Calabrese, and today I'm here with Dr. Bill Rhodes. He's the owner of Premier Equine Veterinary Services in Whitesboro, Texas. Thanks for being with us, Dr. Bill.
Oh, you're welcome. Good to
Yeah,
be here.
yeah, we're glad you're here. Just fascinating, all the things you're doing. I mean, reigning champion, that's amazing. Congratulations.
Thank you.
That is no small feat. President of the Texas Equestrian Veterinary Association, Equine Veterinary. That's amazing. Incredible clinic, mobile clinic. You are a busy man, so we're thankful to have some of your time.
Oh, no problem.
Yeah. So tell us how you heard about Renovo.
So I've been using Renovo for probably a couple years. I'm to be honest with you, I'm not 100% certain, but I feel like I've heard it through a friend and colleague of mine that practices here in North Texas, Dr. Ty Wallace. I think was using it quite a bit and kind of talked to me a little bit about it, and then I started using it. Like I said, for probably 2 years, maybe a little bit more.
Excellent. Well, thank you for being one of the early adopters. We appreciate that. Can you think of an example of a case where you have used Renovo and been impressed by the results?
Yeah, I mean, I can give you a couple examples. I feel with the cases that I've done, I would say I most use it in cases of soft tissue injury, particularly tendons. And the two probably most common injuries that I'll treat and have seen really, really fantastic results are superficial digital flexor tendon lesions. We will do a intralesional injection with the Renovo with ultrasound guidance. And then, at my clinic too, I have a rehabilitation part of it too, where we have treadmills and lasers and things like that to follow up. And I feel like we're seeing pretty amazing results, particularly when we follow the injections up with some pretty intense rehab protocols. So it is my go-to if I do see a lesion on a soft tissue, particularly the superficial digital flexor tendon. The other injury that we see very commonly here and then I've been treating is deep digital flexor tendonitis, particularly in the foot. Those are sometimes challenging to diagnose. Sometimes we are able to see things on ultrasound. Sometimes we'll actually do an MRI to get a diagnosis. It's a very common injury. We see lots of them. And those I've also been treating with the Renovo. Because of the location of the lesion, a lot of those are within the hoof capsule. So it's a little bit harder, if not impossible, to do an intralesional injection. So what I've been doing, if those are in the vicinity anatomically of the navicular bursa, I'm putting the product in the navicular bursa. If it is the lesion, sometimes those lesions are higher and extend up into the pastern. You can do an intralesional injection up there. You can also treat the tendon sheath. And I think one or two cases I've actually done those things in combination with the regional perfusion to try to get it, kind of all over down into that foot. So for me in my practice, those are probably the two most common locations that we've used it and seen some really good results. Like I said, particularly when you combine those with some of the rehabilitation things that we're doing.
That's great. So how did this compare to before you found Renovo, maybe another product that you were using and now you're using this in terms
I mean, Renovo we classify as a biologic. So some of the other biologics myself and all the equine vets were using are stem cells, PRP, which is platelet rich plasma, IRAP, and there's probably some other ones that are that are slipping my mind right now. And I've used all of those things. They have their advantages and they have their disadvantages. What I like about Renovo is you can take it off the shelf, so there's no preparation. You don't have to send any blood or tissue to a lab and then wait for it to come back. So that's very handy. And then I also feel like, honestly, and I don't want to jinx myself, I haven't seen any negative reactions as far as post soreness, swelling, flare reactions that we sometimes see. So I feel like it's really safe. And speaking with my colleagues and stuff that use it, I think they share that sentiment. But so for me, it's just it's at this point it's the results are good, the same if not better than some of those other products. It's like I said, it's easier. You can have the product, it's with the ability now to keep it in a regular freezer for, I believe, 6 weeks. You can keep it on hand and have it, without having to do any incubation or anything like that. And then it's very comparable, if not less expensive than some of those other biologics. So that's just my opinion versus, not to, like I said, I've used all of them. And there are advantages and disadvantages.
Those are all great points. Thank you. So is Renovo something you use with your mobile clinic? Because like you said, you can just put it in a freezer and take it with you.
Yeah. So the mobile part of my practice is mostly when I go to horse shows. So, I guess I honestly, that kind of practice is a little different when you're doing a horse show deal. You're kind of need some quick fixes. So, I haven't used it in that setting. I mean, you could obviously, if you're ambulatory and have, the ability to keep something frozen, which pretty much everybody does, you could for sure use it in the field. I have all of mine, particularly with when I do the ultrasound guided injections, they're all done at the hospital. So, but that's just me. Again, it's very amenable to use out in the field or in a mobile or ambulatory situation.
Excellent. So what would you tell to some other veterinarians who have not yet used Renovo?
Well, don't be afraid to use it in situations where you have a fresh injury, or even I've used it on some chronic stuff too, and it's seen some good results. I think the biggest thing I guess I'm going to tell any colleague is be certain you have a good understanding of what's going on, like a good working diagnosis. And sometimes it's just a working diagnosis. We may not know 100%, but once you're comfortable with what you're dealing with, then don't be afraid to use it. It is considered a biologic, so there's no drug downsides to using steroids and stuff like that. Is it going to fix every problem? No. But I think if you're interested, call somebody that's used it. There's more than lots of other vets besides me that have good experience, and I'm sure you guys can help them get in touch with some of them. But yeah, above all, just don't be afraid, and it's definitely a very valuable tool that you can use, and without having to invest in lab equipment and centrifuges and incubators and things like that.
That is great advice. Thank you. So have you been using it on performance horses and seen any speed of getting back in the arena?
Yeah, that's pretty much all. Most most, if not all, of what we've used it on our performance horses. Obviously, they're the ones getting injured. And, everybody wants to, all of my clients, they want to speed the process. And I'm a little bit cautious in using that terminology. I try to, does it speed up the process? Probably a little bit, but more importantly, particularly in the soft tissues, we want to improve the quality of healing. And if that takes a little bit less time, that's great. But overall, we want to heal the tissue with more functional tissue that's not going to re-injure. So when people ask me about hurrying or speeding the process, I try to kind of bring them back and talk about improving the quality of healing first, and kind of make that a priority. Do I think that it does speed it up? Yes, but I'm pretty cautious with how I verbalize that with people.
Understood. Well, we love that you're out there testing, and that the scans that you do, those results
Yeah.
speak for themselves. So
Yeah, the following up on these is, really important. With ultrasound, particularly on those soft tissue things, I think and that's, that helps a lot in guiding the rest of the whole thing. Renovo is just a part of it. The rehab is a big part of it. All those things play a role, shoeing, things like that. So, I think regular rechecks are super important. And I'm fortunate that a lot of the horses actually stay in my rehab place, so I get to see them on a daily basis. And we can follow things along and monitor their soreness, if they're lame or swelling or anything like that.
wow. Well, Dr. Rhodes, we love that you're out there doing all the things you do to keep horses well, and that you are as thorough as you are, and that you have all of the resources to help the people who need it out there in Whitesboro, Texas, and beyond. So thanks for all you do. We're looking forward to
All
following up
right.
with you in the future.
All right. Sounds good. Thank you.
Thank you.